Palantir has basically embedded itself into our US healthcare system. And what started off as a seed company from for the CIA wound up becoming a 5-year architecture model that they basically built their foundry system in between in all the different agencies under HHS that were never really designed to talk to each other. So, for example, CDC never really talks to FDA. FDA doesn't really talk to CMS. CMS doesn't really talk to CDC because they're separate agencies. They have different functions. What Palantir has done through this $90 million funding grant that they got, which was not bidded out, by the way, they just gave it to them, was they embedded their Foundry backbone, their analysis software, to fill the gaps between the borders of the agencies so that now FDA can now access what CDC is doing and HHS, so across the board. But that's only the part of it. The other part of it was that when you start looking down the chart of what HHS really is between CMS and Medicaid, then they sold the same technology to DHS. Because of the way the analytical system, the analysis system works, was that DHS was able to access Medicaid information with enrollees. And that's how they started doing deportations and how they started finding people to doing Minneapolis and Minnesota deportations, was they were accessing Medicaid data.
Let me read that back to you. I feel like I'm talking to Darth Vader. You are all that's left of a dying religion that still believes in fax machines. You are the only profession that still uses fax machines because that's how backward. By the way, I was there on Capitol Hill as part of a Democratic majority when we were writing the Affordable Care Act. This is one of the core problems we were trying to solve, was trying to get electronic medical records, first of all, to get them to exist. Second of all, to use a system that would tie the fracturing of different electronic medical record systems together. This sounds like nerd alert. Oh, wait, should I do it? Should I do my standard nerd alert?
Nerd alert! It was my understanding that there would be no math.
I don't even know what that means.
No one knows what it means, but it's provocative.
No one gives a shit about tying together electronic. Right. Let me tell you, it matters. There are medical errors that compound because of the handoff of patients from one provider to another. That's the problem we were trying to solve for, so that we could do more handoffs. And you wouldn't have situations like doctors in residency working for 36 hours straight, which is something that my wife lived through and I lived through vicariously and sucks. There was an innocent for the idea of let's get better visibility into what the data is saying. Let's use some AI tools. Let's tie disparate records together. Then I will tell you, I love that. That's a great idea. That's what Democrats were all about. Then you tell me that Sauron got involved. Really, this was all a thinly veiled front to get to descend on the good people of the Shire. And it's just a thinly veiled front for more ICE raids.